Hi, it's Tammy. Today we're going to talk about female hormones and the menstrual cycle. The menstrual cycle is the regular, natural change that occurs in the female reproductive system, specifically the uterus and the ovaries. The menstrual cycle occurs due to the rise and fall of estrogen, which are hormones that are important for sexual and reproductive development. Each cycle can be divided into 3 phases based on the events in the ovary, known as the ovarian cycle, or in the uterus, known as the uterine cycle. The ovarian cycle consists of the follicular phase, ovulation, and luteal phase, whereas the uterine cycle is divided into menstruation, proliferative phase, and secretory phase. Stimulated by gradually increasing amounts of estrogen in the follicular phase, discharges of blood flow stop and the lining of the uterus thickens. Follicles in the ovary begin developing under the influence of a complex set of hormones. The ovaries and other organs of the female reproductive system mature and begin responding to these certain hormones. Release thresholds levels of follicle-stimulating hormone, known as FSH, and LH, luteinizing hormone, stimulate the maturation of the ovarian follicles. Approximately mid-cycle, or 24 to 36 hours after the LH surges, the dominant follicle releases an ovocyte, starting the event of ovulation. After ovulation, the ovocyte only lives for about 24 hours or less without fertilization, while the remains of the dominant follicle in the ovary become a corpus luteum, which has the primary function of producing large amounts of progesterone. Under the influence of progesterone, the uterine lining changes to prepare for potential implantation of an embryo to establish a pregnancy. If implantation does not happen within approximately 2 weeks, the corpus luteum will start to return to its normal condition, causing a sharp drop in the levels of both progesterone and estrogen. This hormonal drop causes the uterus to shed its lining in a process termed menstruation. The length of a woman's menstrual cycle may vary somewhat, with some shorter cycles and some longer cycles. Factors such as genetics, diet, and overall health can affect timing. The luteal phase is the final phase of the ovarian cycle, and it corresponds directly to the secretory phase of the uterine cycle. The uterine cycle has 3 phases, which include menstruation, proliferative, and secretory. The menstrual cycle normally serves as a sign that a woman has not become pregnant. However, there are a number of factors that can cause bleeding during pregnancy. Painful cramping in the abdomen, back, or upper thighs is common during the first few days of menstruation. The proliferative phase is the second phase of the uterine cycle, when estrogen causes the lining of the uterus to grow. As the ovarian follicles mature, they secrete increasing amounts of estradiol and estrogen. The estrogens initiate the formation of a new layer of endometrium in the uterus, often identified as the proliferative endometrium. The secretory phase is the final phase of the uterine cycle, and it corresponds directly to the luteal phase of the ovarian cycle. During this phase, the corpus luteum produces progesterone, which plays a vital role in making the thickened endometrium receptive to implantation and supportive of the early pregnancy by increasing blood flow and uterine secretions. If pregnancy doesn't occur, the thickened endometrium starts to break down, creating a flow of blood and cellular debris known as the menstrual cycle. Thank you.